All right, welcome everyone. I'm ChicagoDLSinc. I do one-on-one tutoring for the Naplex and the MPJE, as well as group sessions. Today we're going to be doing calculations. Just let me know if you can see the screen. What we're going to do is no. What we're going to do is we're going to do practice problems and we'll break them down. And let's see what's going on. Let's stop streaming and let's try again. All right, let me know if you can see the welcome. All right, very good. So what we're going to do, welcome everyone. I'm going to read off the question. These are going to all be calculation questions. My sources are RxPrep and Past Naplex Now, and then plus some that I have modified from old, not but just modified from older questions. And this will be covering area 4 of the Naplex, which is calculations. As we get started, shout out to Suspicious Bunch and Pharma Turtles for arranging this. A lot of good resources out there, whether you choose RxPrep or Pass Naplex now. Make sure that you do it thoroughly, and neither one is better than the other. If you're doing questions and you feel like one is lacking, make sure that you supplement. However, doing both is not practical nor recommended. So I'll read off the question and then we'll break it down using the whiteboard. And if you, when I'm done reading it, if you've worked it out, you can put the answer into the chat. And if you're not sure, you can put a question mark by your answer. So let's start with practice question 1. This is going to be 2 parts. And the question is, a physician orders a 3 microgram per kg per minute drip of drug A. This drug is typically put into a 250 ml bag of D5W. The patient's weight is 135 pounds. Question 1 or part 1 is going to be, how much drug A in milligrams will this patient receive in 30 minutes? Round to the nearest tenth. Question 2, if the infusion ran continuously for 48 hours at the rate of 3 micrograms per kg per minute, how many bags of D5W, each containing 200 milligrams of drug A, would the patient need? I'll go ahead and start with part A and part B after you're done. Starting to see some answers come in. And if you're unsure, that is okay. Like I said, shortly I will break it down. Okay, give it a couple more minutes. All right, I'm going to go ahead and share paint. Can you see the screen? Okay, very good. So let's get started with part one. We have our first step is going to be 135 pounds times 2.2 and sorry, 1 kilogram over 2.2 pounds, and which is the same thing as dividing it, and that will give us 61.4 kilograms. Next, we need to take the 3 micrograms per kg per minute, and we'll multiply that by 61.4 kilograms. That's going to give us 184.2 micrograms per minute. And now the question is asking how much drug in milligrams will this patient receive in 30 minutes? So we'll take 184.2 micrograms per minute and we'll multiply this times 30 minutes. And this will give us 5,526 micrograms. Okay? Now, however, they don't want it in micrograms, they want it in milligrams. So we're going to do 5,526 micrograms. And it's going to be 1 mg over 1,000 micrograms. And that's going to give us 5.5 mgs in 30 minutes. Okay? So, some of you had the micrograms, and some of you didn't do the rounding to the nearest tenth, so please keep that in mind. And And so that's the answer for part one, 5.5 meg. Soma, would you mind sending a message? And next, let's go to part B. Part B is asking if the infusion ran continuously for 48 hours, how many bags containing 200 mgs would the patient need? So we have 184.2 microgram per minute times 60 minutes over 1 hour times 48 hours. Okay, this is going to give us 530,000 micrograms. Now, we remember we have to divide this by 1,000 to get milligrams. And that's going to give us 530 mgs. And because each bag is 200 mgs, we would need 3 bags. Okay? So if you got 3 bags, good job. If I was going a little too fast, my apologies. Does anyone have any questions or concerns about practice question 1? Keep in mind conversion is important, rounding is important. Happy to answer any questions or concerns. Remember, if you think of one later, feel free to send a message. All right, let's go to practice question 2. TR is a 5-year-old male presenting to your pharmacy with his mom who states he has an ear infection. The doctor prescribed amoxicillin 90 mg per kg per day in divided doses every 12 hours for 5 days. Your pharmacy is stocked with a 500 mg per 5 ml amoxicillin suspension. Temp is 100.4, height is 39.5, weight is 34 pounds. The allergy is going to be sulfa. What size bottle of amoxicillin should you dispense to TR? This is multiple choice. A is 75 mils, B is 100, C is 50, and D is do not fill. All right, starting to see some answers. So let's go to 8. So we have 34. First, we have to convert into kilograms. So we have 34 pounds times 1 pound over, 1 kilo over 2.2 pounds. This is going to give us 15.45 kilograms. Next, what we need to do is calculate how much amoxicillin the patient needs to complete. So we're going to do 90 mgs times 15.45 kilograms. And this is going to tell us they need 1390.5 milligrams per day. Then we're going to multiply this times 5 for 5 days, and that's going to give us 6,952.5 milligrams. The third step is going to figure out how many mils of amoxicillin we're going to do, and we know that it's 400 mg per 5 mil, so we're going to set up our ratio. 6952.5 mg over x, and we're going to, on the other side, put 400 mg per 5 ml, and after cross multiplying, we will get 86.9 mils. Okay, and so to fulfill this prescription, we'll need to do answer choice B. So great job. Great job, those of you that chose answer choice B. Also, there are a couple counseling points. Refrigerate the solution when not using and discard after 5 days, even though some will be left over in the bottle. And because this is a pediatric patient, we will counsel the parent or caregiver. Questions or concerns about practice question 2? If you did this and got it right and didn't put it in the chat because you weren't sure, that is okay. Great job. All right, once again, if you think of another one, we'll come back. Now we have practice question 3. FE is a 45-year-old male presenting to your community pharmacy today to pick up some True Metrics glucose test strips. His past medical history includes type 2 diabetes, hyperlipidemia, and hypertension. He is currently taking metformin 500 mg PO BID, Lipitor 40 mg PO daily, and Cozar 25 mg PO daily. Can anyone tell me what the generic is for Cozar in the chat? You learned that he was recently diagnosed with diabetes 8 months ago, and he is still unsure what his A1C means. You explained to him that his A1C is his average blood glucose over the past 2 to 3 months. Knowing that his A1C is 8.4% today, calculate his estimated average blood glucose in mgs per deciliter. Round to the nearest whole number. I'm going to put the equation into the chat. That may take the fun away from it, but you may not have the formula sheet handy. I want to give everyone a chance. All right, starting to get some answers. All right, let's go to the board. So the formula for estimated average glucose is going to be 28.7 times the A1C minus 46.7. So when we plug in 8.4, our answer will be 194.38. However, they asked for the nearest whole number, so that's going to be 194. If you use the calculator, make sure it's in degrees, DEG, and not radian or the third option. If you used a different formula, please double check that. I know there's a chart in both books where it lists the A1C from, say, 5 to 12 or 5 to 13 with the corresponding blood glucose levels. Any questions or concerns for practice question 3? All right, very good. Let's move on to 4. Okay, a concerned mother walks into the pharmacy and would like to pick up her daughter's prescription for oseltamivir. Upon questioning, you find out that her 4-year-old daughter was recently diagnosed with influenza. Daughter's weight is 45 pounds. Her daughter really struggles with breathing, and the mother is having a difficult time with anxiety as well. The recommended dosing is listed for prophylaxis and treatment. Calculate the appropriate dose for the daughter's oseltamivir. And part 2, does Tamiflu require dose adjustments for hepatic or renal? While you're working this out, just a reminder, there will be a survey and um, uh, please fill that out so we can take your feedback and improve. Getting some answers coming in. Looking good. Give everyone another minute to enter their choices. Okay, so very good. Those of you that chose 45 mgs BID, that is correct. And if you said it was renally dosed, that is correct. Or the dose adjustment is for renal, that is correct. So we would take 45 LB. I'm just going to type it into the chat and divide it by 2.2. And this would give us 20.45 kgs. And according to the guidelines that are given, that's going to be 45 mg BID, and it is going to be renally dosed. Adjustment. Okay. If there's impaired renal function, Tamiflu does require renal dose adjustments. Okay, great job. Great job. All right, so I have practice questions 5, 6, and 7 here, and we'll do them one at a time. So for practice, the first one is going to be an over-the-counter medication solution is 0.7% active ingredient. How many milligrams would be in a 30 cc bottle? Round to the nearest whole milligram, please. So we'll start with that first one. All right, starting to get some answers. All right, so I'm going to share the board and let's work this out together. So 1% weight by volume is going to be 1 gram per 100 milliliters. So that means that the 0.7% indicates 700 milligrams per 100 ml. You could also calculate it as 0.7 grams. So because we have 30 ml, we're going to multiply this by 700 mgs per 100 ml, and this will give us 210 milligrams of active ingredient. So if you Typed or guessed 210 milligrams. That is absolutely correct. Great job. All right. Let's go back to practice question 6. A 66-year-old female is 165 centimeters tall, 198 pounds, and is enrolled in an investigation trial for a new cancer medication. The daily dose is 25 mg per kg and is dosed by ideal body weight. What dose should she be given? Once again, we're going to be doing ideal body weight. Daily dose is 25 mg per kg, and we have 165 centimeters tall and 198 pounds. As the answers come in, we'll work it together. Give everyone another minute or so, or two. All right, so let's work this problem together. 165 centimeters is about 5 feet 5 inches. And with the patient being female, we're going to do 45.5 kilograms plus 2.3 kilograms times 5. This is going to give us 57 kilograms. Next, we'll take that 57 kilograms and we'll multiply it by 25 mgs per kg. And this will give us 1,425 milligrams. And so that's going to be your answer. Peacock, was that a typo? Or maybe a miscalculation? All right, very good. Very good. So let's do the last question. And that one's going to be good job if you got it. And if you're not sure, I hope the explanation helped. Practice question 7 is going to be How many vials of 80 mg per 2 ml tobramycin would be required if a provider asked for a 6 mg per kg dose for a female patient weighing 189 pounds? The end is in sight. This is the last question. We need some answers coming in. Good. Let's go ahead and work this out. So first, let's figure out the patient's weight in kilograms. So we're going to do 189 and we'll divide it by 2.2 and this will give us 85.7 kilograms. Next, we need to know how many milligrams of tobramycin are required. So we'll multiply that by 6 mg per kg. And that will give us 514 milligrams. Now, because we know that it's 80 mg per 2 mils, what we're going to do is we'll take that 514 and if it's 80 mgs for 2 mil, that means that for every one, it's going to be 40 mgs. So we will take 514 mgs and we will divide it by, there's two ways to do this. You can do 80 mg by 2 mils, or you can do 40 mg per mil. So I'm going to do the 40, and this is going to give me 12.85 mils of tobramycin solution. With each one being 2 ml, we would need more than 6, so that would round up to 7 vials. So, great job if you guessed 7 vials, and that is what would be required to fill this order. And by the way, no one responded what the generic was for Cozar, and that was going to be losartan. There are excellent resources for the brand and generics. Make sure that you are reviewing them. There's a link in the resource guide for top 200 and top 300. Please make sure that you get a chance to review it. Vicky, that's a great question. Shouldn't we use adjusted body weight? Is tobramycin on that list, or the Naplex will give you guidance on which body weight to use? There's some medications that are always ideal body weight, and you definitely should pay attention to those. I believe acyclovir is one. Does anyone have any questions or concerns about the problems that we have done today, calculations in general, the Naplex, MPJE, or, well, if you're not sure, why the sky is blue, we'll have to get to that privately. A good way to clarify, Vicky, you are correct. Height was not given, so we can't use adjusted body weight. All right. Does anyone have any questions or concerns about calculations in general, the problems that we did today? All right. Good job, everyone. Enjoy your evening. Don't forget to take the survey. Have a good weekend. And by tomorrow, the schedule will be up for next week. You're welcome, everyone. Take care.